Hello and welcome to today's presentation. Today we shall be looking at breastfeeding. Breastfeeding is an important component that determines the milestones of a baby. And this is the only mode of nutrition that is most cost effective. So we'll be looking at, based on this outline, we look at the 10 steps to promote successful breastfeeding, the five main breastfeeding positions, look at breast care for the new breastfeeding patients, new mothers, look at the technique for hand expression, and also show you how to perform the reverse pressure softening technique. We'll also state some complications associated with breastfeeding. And lastly, we'll look at the importance and the advantages of breastfeeding. So let's get right into it. So we begin by defining breastfeeding according to WHO, World Health Organization. So WHO defines breastfeeding as the normal way of providing young infants with nutrients they need for healthy growth and development. So almost all mothers can breastfeed, provided they have accurate information, the support of their family, the healthcare system, and the society at large. So World Health Organization emphasizes exclusive breastfeeding for the first 6 months of life, meaning that the infant only receives breast milk without any additional food or drink, not even water, unless it is medically approved or indicated. So after 6 months, complementary foods should be introduced while continuing breastfeeding for up to 2 years of age or beyond. So we have 10 steps to promote successful breastfeeding, and these ones are normally supported by the healthcare system. Of course, the healthcare system should comply fully with the International Code of Marketing of Breast Milk Substitute, relevant World Health Assembly resolutions. Healthcare systems or hospitals should have a written infant feeding policy that is routinely communicated to staff and the parents. They also need to establish ongoing monitoring and data management system to know that how the breastfeeding techniques and also the clients that are being breastfed. Ensure that the staff have sufficient knowledge, competence, and skills to support breastfeeding. They also need to discuss the importance and management of breastfeeding with pregnant women and their families. Also, they need to facilitate immediate and interrupted skin to skin contact and support the mothers to initiate breastfeeding as soon as possible after birth. They also need to support the mothers and to initiate and maintain breastfeeding and manage common difficulties. They also do not provide breastfed newborns with any food or drinks unless it has been medically approved. Remember, this is part of the definition of breastfeeding according to World Health Organization. They also should enable mothers and their infants to remain together and practice rooming. They also need to support mothers to recognize and respond to their infant cues for feeding based on the milestone. Remember, a link will be popping up to look at the growth and development of the babies. Also need to counsel mothers on the use and the risk of feeding bottles, the treats, and the pacifiers. And lastly, coordinate discharge so that parents and their infants have timely access to ongoing support and care. So we have breastfeeding positions, and ordinarily a patient can choose a breastfeeding position that they are comfortable and is efficient. If discomfort occurs in one position, the young mother can choose another position. In fact, by changing position periodically, the mother can alter the infant's grasp on the nipple and avoid contact friction on the same area. So typical positions, breastfeeding position, we have like the cradle position, we have the cross cradle hold, we also have the clutch or the football, the side lying, and the laid back position. So let's look at those five positions of breastfeeding, starting with the first one. So for the cradle position, you find that the mother sits in a comfortable position and cradles the infant's head on the patient's forearm and the infant's back along the inner arm and the palm. This is shown as on our figure on our right. And if the patient had a cesarean section, you find that cradle position may put too much pressure on the abdominal incision, and thus may not be favorable for mothers who have undergone a cesarean section. Number two is the cross cradle hold. So during the cross cradle position, this is how we position the infant on our right. So during the early weeks of breastfeeding, many patients find cross-cradle position very comfortable. So the infant just lies on a pillow across the front of the mother's body. So using the opposite hand from the breast being being used, the mother places a hand behind the infant's ears and the neck, with a thumb and index finger behind each ear. So the infant's neck rests on the web between the mother's thumb, index finger, and the palm. The mother supports the infant's back with the arm, which is lying on the pillow. The third position is the clutch hold or the football position. See, this is commonly selected by patients with large breasts and those who have had cesarean section. So the clutch position is also useful for feeding twins and infants who are small or premature. So the infant is held at a patient side with the patient's elbow bent, supporting the infant's back with the arm and the infant's head with the hand. Pillows can be used to bring the infant up to the nipple height. The fourth position is side lying hold, and a mother can choose the side lying position for breastfeeding at night or during recovery from a cesarean section. So the mother lies on one side with the stomach facing the infant's stomach and the infant's head facing the breast. So the infant's ear, shoulder, and hip should be in one line with the hips flexed. The infant's body can be cradled to the mother's arm with the back against the patient or the mother's forearm. Last breastfeeding position is the laid back position. So to use the laid back position, the mother lies back with the head and shoulders well supported, allowing the infant's whole front body to touch the mother's body. So the infant's cheek rests somewhere near the mom's bare breast. The infant uses natural instinct to breastfeed. The mother helps the infant as much as desired. This method encourages the patient and the infant to relax and enjoy each other. So those are the 5 breastfeeding positions. Let's look at the breast care for new breastfeeding patients or mothers. You have to ensure that as a nurse, you instruct the patient to wash the breast with water only. Remember, soap, lotions, oil, and petroleum jelly can interfere with the skin's natural lubrication and can result in sore nipples. You could suggest that the mother lubricate the nipple with a few drops of express milk after breastfeeding, and this is majorly to prevent tenderness. Also inform the mother that the milk volume will increase between the second and the fifth day after childbirth and may be accompanied by slight temperature elevation, breast changes such as increased size, warmth, and firmness. You also advise the mother with engorged breast to apply warm compresses, massage the breast, use the reverse pressure softening technique, take a warm towel shower, or express some milk before breastfeeding, and to use cold compresses after or between feedings to decrease swelling. These techniques dilate the blood ducts, promote milk letdown, and make the nipples more pliable. If the nipples become sore or cracked, you explain that the mother can apply warm moist compresses, moist tea bags, express milk, or lalon cream to promote comfort and healing. Advise the mother to seek assistance of a certified lactation consultant for additional treatment options such as breast shells, breast shields, and gel pads to ensure proper use. You need to teach the mother to recognize and report signs of a plugged milk duct, which typically presents a small, palpable, tender breast lump. suggests that the mother can apply warm compresses and massage the breast while the infant is breastfeeding to help remove the blockage. Also, suggests altering the infant's position during breastfeeding and avoiding constricting clothing to help prevent milk stasis and future plugged milk ducts. So those are how we care for the breast. We also have the hand expression where this is normally used and applied when we have breast engorgement. So hand expression of milk between breastfeeding can also help the patient avoid breast engorgement. The mother can use various techniques to express milk by the hand, and you could do the following steps whereby you instruct the mother to hold a hand in a C-shaped with the thumb on top. You tell the patient or the mother to position the fingers at about 1 to 1.5 inches behind the nipple. Also, you instruct the mother to keep the fingers together to avoid cupping the breast. You teach the patient to apply gentle pressure with the thumb on the top of the breast, pressing straight back against the chest. Advise the mother to roll the thumb and fingers towards the nipple while pushing against the chest. Instruct the mother to continue pressing inward while rolling the fingers over the breast tissue. You have to explain that the mother may need to apply pressure closer or further away from the nipple to find the location of the milk ducts. We also have the reverse pressure softening technique, and this technique can be helpful in the early days after an infant is born. When here the mother experiences firmness of the areola, the latch pain, or the breast fullness. So this technique, the reverse pressure softening technique, moves some of the swelling back and up into the breast, causing the areola to soften. So as the swelling moves back and up, the milk moves forward where the infant's tongue can reach it. This technique also makes it easier for the mother to express milk using the fingers if needed. Keep in mind that the mother shouldn't use the reverse pressure softening technique in the presence of a plugged duct, mastitis, or an abscess. So what are some of the steps that you can use in the reverse pressure softening technique? You instruct the mother to place the middle three fingers of each hand on the left and the right sides of the areola within 1 inch circle touching the nipple. You advise the mother to push gently but firmly straight inward toward the ribs and tell the mother to hold steady pressure for a count of 50. Well, there are some complications that are associated with breastfeeding. Of course, one of the most common one, we have the breast engorgement, where that is characterized by breast pain and tenderness. We also have the inflammation of the resulting into the mastitis, fungal infection like the thrush, nipple pain, plaque ducts, infant complication due to insufficient milk supply or inadequate milk transfer like dehydration, poor weight gain, and jaundice. Well, you have some of the advantages of breastfeeding, and we could use the breastfeeding as the mnemonic where B represent bonding. So, breastfeeding promotes a strong emotional connections between the mother and the baby. R is reduce risks. Breastfeeding decreases the baby's risk of infection, allergies, obesity, and chronic illness like diabetes. E is for economical. So breastfeeding is cost effective as it eliminates the need for formula and or the feeding bottles. A is for antibodies. Breastfeeding provides vital antibodies that boost the patient's immunity, protecting against infection. S is for sustainability. You find that breastfeeding is environmentally friendly with no package processing or waste. T is for temperature regulation. Breastfeeding encourages skin-to-skin contact, which helps regulate the baby's body temperature. F is for fewer illnesses. Breastfed babies have lower incidence of diarrhea, respiratory infection, and ear infections. E is for exclusive nutrition. Breastfeeding offers complete and perfectly balanced nutrition for the baby's growth and development. E is for emotional benefits. Breastfeeding releases oxytocin in the mother, reducing stress and promoting relaxation. D is for digestive health. So breast milk is easily digestible, and this reduces the chances of constipation or colic in babies. I is for intelligence. Breastfeeding is associated with higher IQ scores and cognitive development in children. N is for nutritional benefits. Breast milk contains essential vitamins, minerals, and enzymes tailored to the baby's needs. And lastly is G for growth. Breastfeeding supports healthy physical and mental development during the baby's crucial growth phases. Well, those are some of the major importance of breastfeeding.